let's go through to case number 5. Okay, so I'm just going to download the images and then change to abdominal windows. So this patient they were in a car crash, actually. I think they were riding a motorcycle. And what happened was they were riding the motorcycle, they fell off the motorcycle, literally skidded for like ages. I mean, it's not funny. I'm just saying, it's not great, is it? So they had continued hip pain and they're looking for a fracture. So what we did the bone windows, and they were having right-sided hip pain. And what you've got to do is just try and make sure that the cortex doesn't look like it's broken at any point. And we may need to zoom in a bit. So let's zoom in a bit, just have a look. So I haven't checked the chat in a while. Nothing there. And let's see, nothing there. Okay, good. Hopefully no questions. Well, I don't mind questions, so feel free to ask. So you scroll through, and especially with the neck, you got to be really careful when you zoom in, because you just want to make sure that obviously there are fractures that are obvious, right? Like you're looking at a proper discrepancy. But sometimes what you get is like a kind of a slightly increased sclerotic line going like this, and that's like a really subtle impaction fracture. And I missed one. I missed it once actually. And then we had to do an MRI scan, and the MRI scan showed like florid edema within that region. You go back to the CT, there it was. It was like a subtle fracture. But here, actually, I can't convincingly say I can see a fracture. Everything looks pretty normal. Inferior and superior pubic ramus look okay as well. Acetabulum looks all right. And then we've got to look at the rest of the osseous structures just to make sure, because sometimes you get these patients who've got fractures of the pelvis, right? Or they've got dehiscence of the sacroiliac joint. So one of the things to do is just to make sure that this and this are equidistant. They look about the same. There doesn't look like one's slightly bigger than the other. Also look at the trabeculation of the sacroiliac. There have been fractures that are kind of really subtle that go all the way through and connect to the sacroiliac joints, and they can be quite difficult to see. So actually on this one, I haven't really seen much wrong. Has anyone else seen anything wrong? Okay, so let's go back to abdominal window. So then you've got to try and make sure, okay, so this patient's got abdominal pain. Let's go through bowels. Let's have a look. Bowel looks okay so far. I can't see any hernia or anything like that. Everything looks okay. As much of the bowel as that we've got, we can see it looks all right. Right iliac fossa looks okay as well. Not really much going on, but some of you may have spotted that there is some fat stranding located within the subcutaneous tissues over here and over here. Now, this is not the usual subcutaneous edema that you'd otherwise get with someone who's got heart failure, because this looks slightly denser than usual. And you can see there's a tiny little blob there, which you don't usually get with subcutaneous edema. And not just that, you've also got what looks like a elliptical, hyperdense region sitting within that area over there, just overlying the musculature. So that's probably overlying the TFL and the TFL and the lateral thigh muscle. And you can see it's kind of causes an indentation over there. So this is something called Morel-Lavallée syndrome, I guess, or injury. And so what's ended up happening is that you've got like a fascial plane between the musculature and the underlying subcutaneous tissues. This patient skidded. So what ended up happening is you kind of got a bit of skin that was kind of stuck on the pavement, and it pulled everything away from the underlying musculature, and you get this shearing injury. And then because of that gap, it starts to bleed like so, and ends up giving this very sort of crescentic appearance, hyperdense material. So this is actually hematoma. Not really much you need to do. I think once the clinical team actually did ask us to train it, the patient was really uncomfortable, like really uncomfortable. I mean, obviously they're going to be uncomfortable. Sometimes what you may need to do is, if it continues to bleed, you may need to do different phases of imaging. This looks like a non-contrast study. If they get worse, you may need to do an arterial phase and a delayed phase, because sometimes you do get a little blush of contrast sitting within there, suggesting that they continue to bleed and they're probably not going to stop anytime soon, and may need to get some intervention as a result of it. But anyway, yeah, so that's a Morel-Lavallée injury, and there's some really great articles and images out there, and I think that's a really good example of, I'm always going to say the good examples are my examples, aren't they?